Did you know that up to 25% of women will have some form of symphysis pubis dysfunction with pregnancy? How do you work with clients who complain about the pubic bone feeling bruised or who have severe pubic bone pain? In today's episode, I share with you what I do to treat pubic symphysis dysfunction in both pregnant and postpartum clients.
Hello, friends. This is Lynn Schulte, and you are listening to the Birth Healing Summit podcast. We are here for meaningful conversations that will transform the way you work with pregnant and postpartum clients. Whether it is a new perspective, tool, or technique, you'll be able to implement it into your practice today. I invite you to sit back, listen with an open mind, and grab the golden nugget today's guest has to offer. Now let's get started.
Hello, everyone, and welcome to this episode. Today, I'd like to have a talk about symphysis pubis dysfunction and what we should be thinking about as therapists when dealing with our clients who are complaining of this issue. And I want to talk about it in pregnancy and in postpartum. So in pregnancy, when a client comes to see me and they're dealing with symphysis pubis pain, there's so many different things that can be contributed to it, and I'm probably not gonna cover it all, but this is just kind of my brain dump of what I would be thinking of and what I would be looking for with my clients complaining of symphysis pubis dysfunction in pregnancy. And, I wanna start off with knowing that symphysis pubis dysfunction or sacroiliac joint pain are very connected because they're the three joints of the ring of the pelvis. So if we're having problems in one, there may be a problem in the other or vice versa. So we need to be thinking about the entire pelvis. And I loved my interview with Cecile Roost. I think it was 2 or 3 years ago on the Birth Healing Summit. She wrote a book called the Relieving Pelvic Pain During and After Pregnancy is her book, I believe. Roost is Rost. And in that book, she talks a lot about her own personal experience of 3 pregnancies dealing with debilitating pelvic pain. She had instability going on. And what she discovered for herself is that she had some hypermobility. I believe the most common presentation that we find with symphysis pubis pain in pregnancy is hyperextension of the knees with the internal rotation. And when someone is doing that posture, we're actually putting more pressure on the anterior part of the pelvis than on the posterior part. So we need to help get our mamas from more balanced in their pelvis by helping them to keep a slight bend in their knee, keeping more of an external rotation of their legs, which will help balance the pressures on their pelvis, bringing more stability to the sacroiliac joints and to the symphysis pubis joint in and of itself. And then it's helping to educate them in postures and ways of moving to keep better stability of their pelvis. And she does have a app. It used to be free. I think that it's now a couple of dollars, but Roost Moves Mamas is a great app for our clients to get so that they can learn how to use the different mechanics during different activities. So that is one component. So when we're dealing with pelvic pain, I always think of two issues going on. One, they could be in the camp of hypermobility, and we're just talking about that hyperextension, internal rotation of the legs. That's a hypermobility. And then we just strengthening. We need to help stabilize the pelvis and get their muscle strong to support greater stability in the pelvis. And that's, get her book, read her book, get the app so that you know what to refer your clients to. And then the other aspect, hypermobility is one. The other aspect is just pelvic dysfunction. So there is a dysfunction somewhere within the pelvic ring, whether it's the sacrum in the sacroiliac joint, whether it's the ilium, or whether it's the pubic joint itself. We need to address whatever that dysfunction is to help relieve the symphysis pubis pain. And I teach how to treat the pubic bone and the pubic rami bone in my holistic treatment of the postpartum body course. So you can learn how I mobilize and treat and release the sacrum and the pubic rami bone, or I'm sorry, not the sacrum, but how I treat the pubic bone using the sacrum. That's what I meant to say. And then also the rami bone as well. to release any hardness in the bone itself. I know in a postpartum client, as that baby's coming through, it does put more tension and pressure on the left pubic bone, pubic rami, and that bone, those bones get hard after a birth. And so if it's a subsequent pregnancy and we're dealing with pelvic pain or symphysis pubis dysfunction, we want to make sure that we get the bones back to the normal position, close up that open birthing pattern, get the ischiums back into midline, get sacrum out of flexion, and then release any hardness from the rami and the pubic bone. And that can really help with symphysis pubis dysfunction. Treat the bones first and then do your intravaginal work to release the pelvic floor muscles that may be secondarily tight from the bony malpositions, and we release the muscles, and then that should help with their pelvic pain, that symphysis pubis dysfunction. When pregnant clients are dealing with SPD pain, we really want to help them to stay more bilateral with their motions and avoid any unilateral exercises like single leg squats. Let's keep them doing double leg squats. Let's help them to, and this is what I really appreciated about Cecile's book, is learning how to maneuver. I know a lot of us, I was taught to keep the knees together if we have symphysis pubis pain. However, the knees apart might be more stabilizing to our clients' pelvises. So we need to give our clients option and help them to determine for themselves which feels better for them in getting in and out of the car. Do we keep the knees together to do that? Or do we keep the legs apart and bring one leg in, swivel around? So get your butt in the car first, bring one leg across and then the other leg. Either way is fine, whatever helps them to stay out of pain. Rolling over in bed, sometimes it helps to press the knees together and do it, or sometimes it helps to keep the knees apart and roll over, keeping the knees apart and doing it in segments as they maneuver in bed. So know that there's options, and know that it's not always keeping the knees together that is helpful for our clients when they're managing their mobility. Sometimes keeping the knees apart can actually be more stabilizing to the pelvis and might be helpful to your clients. So see what works best for them. Let me think, is there anything else during pregnancy with the symphysis pubis dysfunction? Really, in my mind, I have the two camps of hypermobility versus dysfunction, and we can treat a dysfunction somewhere in that pelvic ring, whether the sacrum's not happy or the ilium are not in a good position. That all impacts the symphysis pubis. You learn how to work with the bones of the pelvis in both my holistic treatment of the pregnant or postpartum body course. In postpartum body, I do treat more the symphysis pubis and the rami bones. You learn how to do it there. Now, when it comes to postpartum care and we have our clients coming in complaining of symphysis pubis dysfunction, the very first thing that I do is I help bring the ischial tuberosities back to their midline position. Depending on the position the baby was in when the position the mom was in when the baby came out, that is what we want to keep in mind of which ischium might have a little bit more pressure on it, which one might be a little bit more out to the side, and really helping to bring that back in. If the ischial bone is slightly out to the side, that's going to, there's a direct connection through the rami bone up to the symphysis pubis. So we want to help bring that bone back into its midline position to decrease the strain and stress on the sacroiliac or on the symphysis pubis joint. And so that's my first thing that I do. And then I assess pubic bone, pubic rami, and treat any hardnesses in there. And then also we need to address posture. We need to address, that hypermobility and hyperextension of the knees, internal rotation. We need to address the pelvic floor muscles and get any increased tension of the pelvic floor muscles to let go. And again, I use the pelvic bones, the hold, the Schulte hold that I teach in my courses, to use the pelvic bones while we're doing intravaginal work And that helps the muscles to just relax and let go so much easier than if we don't have our hand on the bones. And making sure that sacrum can move evenly in the sacroiliac joint, the ilium are balanced, and really balancing the PSISs to the ischial tuberosities. Rebalancing the ilium and ischiums is so critical after birth. In fact, I'm finding that even in my non-birthing clients. I just worked with someone this week who had a total knee replacement, and she's complaining about all this right-sided, her right knee was replaced, and her right ilium, right low back, right quadratus, psoas muscle, all of it is just kind of like in this tension in her body. And she's a massage therapist, so she's like rolling it out and trying to figure it out. Well, when I went to assess her pelvis, it felt like her PSISs, both PSISs were to the left, while both ischial tuberosities were to the right, like both sides. So like there was this malalignment from top to bottom, and not sure what caused that, but I was helping to just try to bring the ischiums back into more midline. They were off to the right, and bring them back into midline and help to rebalance the top part of the pelvis to the bottom part of the pelvis. And it made a huge difference in how all the muscles that attach to those bones relaxed. And so keep the techniques that I teach in my courses can be used on any person. And I'm really using the ischium ilium rebalancing on all my clients, because that is really how the bones of the pelvis need to be, I want to say positioned, but they need to have good mobility, and they need to be in a good position for all the muscles and everything to be able to function well. So that is my focus when working with anybody with hip, back, or pelvic pain, is I want to address all the bones and make sure that they have good mobility, good softness, good structural integrity, like they're in their proper position. That's what helps to make everything happy so it can function better. So that is how I treat postpartum SPD. And I hope that listening into this episode, you have a few more ideas on ways that you can approach and help support your clients that are dealing with symphysis pubis dysfunction. And I know there's, we could do the shotgun approach using adductors and abductors to help position the bone better in the joint itself. I do know that when that symphysis pubis joint feels bruised to the touch, that joint is not in its proper place. That is and when you do get it in its better place, the bruised feeling goes away. So if you're palpating that symphysis pubis joint and your client complains that it feels bruised, know that that joint is not in its proper place, and you need to work to address it and adjust it. You could do this shotgun approach and see if that helps, where you resist a deduction of the knees together, and you can do it in 3 different positions, and you can resist a abduction of the knees apart, and in 3 different positions. And sometimes that you'll hear and the joint pops back into place, and that's a good thing. That's what we want. We don't always hear a noise when that happens, so the noise is not the goal. Using the muscles can just help reposition that joint, and you want to get it to where it doesn't feel bruised. Then the joint is happy again. Okay, so I hope that's helpful. Please comment and let me know your thoughts on this. I'm happy. I'd love to hear what I missed, okay? Because is there something I don't have all the answers. I love hearing and learning from you all as well. So let me know if there's something else that we should be addressing or thinking about when dealing with symphysis pubis dysfunction. All right, everybody, thanks so much for listening in, and I will see you all in the next episode. Here is to smoother births and faster recoveries. Take care, everybody. Bye-bye.
Today's podcast was brought to you by the Institute for Birth Healing. To discover more, visit instituteforbirthhealing.com. To claim $50 off of any online course, use coupon code PODCAST50 at checkout. Till next time, I'm Lynn Schulte, founder of the Institute for Birth Healing.